Awesome. Hi, everyone. Welcome. Welcome. We are gonna give it about a minute more to let some more folks join us and for us to get settled. Um, in the meantime, I would love to know where you are calling from, your name. Feel free to drop also what you are looking forward to getting out of tonight. You can also come off mute if you want to, like, if you're feeling a little free and you want the people to know your voice and your name. I'm
It's
sorry, you can drop it in the Q&A chat or in the Q&A.
yeah, because I think chat is disabled.
Yes, we did do that. Safety first.
I appeared.
Hi, my name is Deb. I'm from Maryland, and I'm looking for anything that we can do to reverse this ridiculous Roe versus Wade decision that's taken us back 50 years. My granddaughters will have less rights than I had since 1973, and I'm not happy about that.
Yes. Thank you for sharing that, Deb. We
Okay.
feel the same way, and that's why we're here, right? We're here to learn more, do something about it, and try to make our lives and the future lives better. Okay, how are folks feeling? Let's get started.
Okay. Yes. Well, I am here. As I said, my name is Freya. I'm from Atlanta, and I'm here in hopes of making some connections so we can get some activism going to not only turn this Roe v. Wade reversal into a victory rather than a defeat, or a Pyrrhic victory for the anti-choice people. Another thing I would love to see is for these crisis pregnancy clinics to be shut down and outlawed permanently.
Yeah. We agree. That's what I could say. And you're in the right space. I'm so glad you came, Freya. Thank you. Thank you for saying that out loud. Okay, folks. So welcome again. Thank you so much for joining our fifth Keep Marching meeting of 2023. A conversation about moms, abortions, and the current state of reproductive health care in our country. I am Joy. It is lovely to meet you. And I'm a part of Moms Rising's member engagement team, and I lead in our Keep Marching online calls. So we always plan for these calls to be about 60 minutes long, but if it is going well, and I do expect that it will be very rich, we'll definitely let it go over time. So if you cannot stay, you need to leave, don't worry. The meeting is being recorded and will be shared widely. So you can always come back and watch what you missed. So if you're not familiar with Zoom, here are some brief instructions. So in the top right corner of your screen, you will see options for speaker or gallery view. We definitely encourage you to select speaker for today's conversation, but you can always toggle between both during the program. And then in the top right corner of your own small box where you see yourself, you should see functions under your control. If you are not being identified by your name, please rename yourself. We would love to know who is in the room with us. And the top right corner of your box, you will also see mute. Please keep yourself on mute unless you are speaking so we can reduce background noise for everyone. So now look at the bottom of your Zoom page. You should see a function called Q&A. Click that and a window will appear on your screen. And so this is where you can ask questions, you can put opinions, anything that resonates with you. Please put that in here and we'll try to get to as many questions as possible at the end. We also have reactions in the bottom page of your screen. So if at any time someone is saying something that you really agree with, feel free to give a thumbs up, you can clap, you can put a heart, react so that we know that you're feeling the conversation, okay? And then finally, remember, don't do anything that you don't want seen on camera. This is being recorded again and will live on the internet. So if you have thoughts or questions, as always, you can put them in the Q&A box, or you can send an email to keepmarching@MomsRising.org. Awesome. So if this is your first interaction with Moms Rising, you are most definitely welcome. Moms Rising is a national on-the-ground and online advocacy organization with more than 1 million moms and family members across the country. Our mission remains to increase family economic security, decrease discrimination, and really build a nation where both businesses and families can thrive. We are multi-issue and intersectional with a unique and inclusive membership of mothers and family members that roughly tracks with the US Census. And we were founded on pocketbook issues such as paid family and medical leave and fair pay. And these continue to be at the core of the work that we do. But over time, of course, we have grown and we have become the go-to umbrella organization for leading issues that impact mothers and families. So currently we work on workplace justice, early learning, maternal justice, healthcare, immigration, gun safety, you name it, we likely work on it. So to those of you who have not participated in a Keep Marching call before, you are especially welcome. We're so glad you've joined us. So Keep Marching is really a space for our highly engaged active members who are taking online action, making phone calls, sharing their personal stories, and working in their own communities, whatever their capacity is for change. And of course, attending events like this to learn and empower your advocacy. So it's really this place where you have the most access to us, Moms Rising staff, and resources, and how we support you in your activism and develop your leadership. As always, this event is plans to be 60 minutes long, but we may go over time, but it's also being recorded. So if you can't see, you can always come back and watch it. And don't forget to use the Q&A function to submit any questions, thoughts, feelings. We welcome it all. And to also use the reaction. So we really know that you're feeling what's going on here. So now we can get to our program. It is my pleasure to pass this to Jada, Moms Rising's campaign director of reproductive justice, to introduce our guest and really lead the conversation.
Thank you, Joy. Hi, everyone. My name is Jada. In the box, it says Diarra, but it's pronounced Jada. My pronouns are she, her. I'm the campaign director of reproductive justice at Moms Rising. And I work within the umbrella of maternal justice and the campaign of maternal health rights and justice. And so, yeah, I'm just going to get right into it. And Joy, if you want to share the presentation so that we can really get into the nitty gritty of what we're going to be talking about today.
Can you see my screen?
It's starting up. Yep, it's loading.
Perfect.
Right. So today I'm going to be talking about reproductive health rights and justice and how that relates to an organization like Moms Rising, an organization that's totally dedicated to helping and build out equitable and sustainable lives for moms, children, and families, right? That's what we all know Moms Rising to be. Well, America's moms were faced with the unthinkable when the US Supreme Court relegated our autonomy to the states, making our ability to access and reproductive health care when we most needed it almost impossible. Everything changed for every woman, every family, and every mother in the past 2.5 years. 6 in 10 people who have abortions are moms. And polls show that the majority of people in America agree. Abortion care should be accessible to all who need it. Being able to choose if we have children, and if so, when and how many children to have is a fundamental right. And I myself don't even have children yet, but I would love that right to choose when and how I decide to have children. We know that having children, we know that having the authority over what we do with our bodies is not limited to our reproductive rights, but has helped narrow the gender pay gap, improve the overall health of women and families, and leads women towards access to increased economic and political power. You can go to the next slide, Joy. Please. We believe that at Moms Rising that We believe in what we call moms by choice, parents for choice. By the end of the night, I hope that everyone leaves chanting this: moms by choice and parents for choice. It is also my hope that by the end of this conversation, we help bridge the gap between issue areas like paid leave, childcare, equal pay, so that you fully understand the intersectionalities and nuances of abortion in your own life and any person that you love. At Moms Rising, our overall message to you is that the fundamental right to make decisions about our lives, our futures, and families is essential to the pursuit of not only racial and social justice, but economic justice as well. To help me convey this message, I have invited to join us Angela Cobian, who is the National Director of Coalition Advocacy at Planned Parenthood Federation of America. She is the co-director of the National Coalition We Demand More, a coalition that seeks to win congressional and administrative campaigns to advance a progressive agenda for women and girls in health and equity and reproductive rights. Angela has also helped establish the mobilization and organizing table of the National Liberate Abortion Campaign that Moms Rising is also a part of. Angela works at the intersection of teaching, adult learning, and civic and social change. She has worked with organizers across the country to strengthen recruitment, selection, and retention of organizing committees, as well as rebuilding bases and launching new regions. She is driven by the activation of parents, educators, immigrant communities, youth, and women in community organizing as a means to strengthen democracy. From direct service as an elementary school teacher to leadership development of people and as a community organizer, to a governance role on the Denver Board Education, Angela is moved by her students, neighbors, and the teams she has managed. Angela, how are you?
I'm doing great. I'm really excited to be here, and I'm so happy to have been invited.
Thank you so much for joining us. Joy, you can go to the next slide, please. So some of our goals at Moms Rising, when we speak about abortion care and reproductive health rights, are to prevent the criminalization of people seeking and providing abortion. We want to change the public narrative that currently envelopes abortion. Uplift that most women who have abortions are already moms and parents. Emphasize the need for affordable and easily accessible abortion, culturally competent sex education, birth control, post-abortion counseling, and other reproductive health services. And as our mission, how we're doing this is by combating misinformation through media trainings, social media engagement, on the ground, lobbying, building membership through e-outreaches, meeting with members on the ground, and just organizing our folks and people that we know to stand against anti-abortion rhetoric. So my first question, and so how we're going to do this, how we're going to have this conversation is that I'm going to go through the slides, and then I'll be asking our expert, Angela, and then she'll give an answer to the questions. And so for my first question, Angela, I'd like to ask you, how did we get here? Can you briefly bring us through the history of abortion and abortion care in the U.S.?
Yeah, thank you so much, Jada, for having me here tonight. And when I thought about how to best talk about the history of abortion care through now, I thought about the work that you and I have done together through We Demand More and Liberate Abortion, where we're really working at the intersection of abortion rights and how it connects to the other issues that affect moms and patients alike. Because when we've done our work together in coalitions, it's never been in a silo. So you have a brief and very precise timeline that is in front of you right now. You can see that pre-Roe, the Supreme Court did not invent legal abortion, much less abortion itself. That abortion, both legal and illegal, had long since been a part of life in the country that we live in. Then that takes us to 1973, where, as you heard, one of the Moms Rising members at the top of the call who said that their family members are going to have less rights than she did. That is a very good personal anchor to 1973, which is when the Supreme Court legalized abortion access federally across the country, and then to where we are now. Something else that I would like to share about in answering the history of abortion is also the history of reproductive justice. Now, you might be wondering to yourself, what is reproductive justice? Reproductive justice is a framework that was coined by Black women, the founders of the reproductive justice movement, to address and also expand the discussion of all of the structural needs and unique needs that communities that have been marginalized experience. So, in other words, and on a personal note, I can share the history of abortion is inextricable from other issues that women, moms, femmes, and non-binary people face. So, for example, I am zooming into you tonight from Denver, Colorado, as the daughter of proud Mexican immigrants. And I want to share a little bit about how my parents' immigration history connects to reproductive justice and also the history of abortion care. My mom became pregnant with me, and it was actually my maternal grandmother who, at the point that my mom discovers that she's pregnant with me, she already had my brother, whose name is Hector, and was 4 years old. My grandmother told my mother, "Where do you think that your daughter will have more opportunities?" And my mom talks about how, like, that was really the moment where she felt compelled to immigrate from Central West Mexico to the United States, because she knew that she was choosing to become a parent and she wanted to specifically be a parent in the United States. And because the Immigration Relief and Control Act also passed in 1987, my parents were able to not only choose when they became parents, but also became naturalized American citizens, which gave myself, 4 years later, my younger sister, the ability to live and work in this country without fear of recrimination for our immigration status, and really exercise that authority. I loved the use of that word, Jada, that you mentioned about having authority our over our bodies. So you do see this timeline pre-Roe, 1973, present, but there's also things that we each hold to be true as intersections to this timeline. The example that I gave of the Immigration Relief and Control Act, or IRCA, of 1987, is just a couple of years right after the Supreme Court decision, right? And ultimately, abortion care is healthcare. And so that is one of the reasons why it's so important that we think about how that decision for each of us intersects with other issues.
Thank you for that. And thank you for sharing your story too. It's a very powerful story. And here at Moms Rising, we also urge folks to tell their stories. And I'll get to that as we go along in the presentation. Joy, can you reach the next slide, please? So we know that there are some hard truths about abortion, especially in these past 3 to 4, I would even say 5 years, that we've been faced with when we look at our reproductive health care as a whole. We've seen abortion bans, and we've seen state legislation go through that are unthinkable. I live in Houston, Texas, so I've been completely, like, my jaw dropped when SB 8 was passed. And I'm living through what feels like a reproductive healthcare desert. We've all have experienced the consequential impacts of Dobbs. And we're seeing the criminalization of people who are seeking in Nevada criminalized. But what we are seeing is of the criminalization of Black and Indigenous and Latina women, especially healthcare and abortion care in this country. So Angela, would as the hard truths that we are, this continues.
Yeah, absolutely. I am happy to share a little bit more about some of those hard truths about abortion care and how they relate to moms, patients, and the way that we live our daily lives. Can you hear me okay?
Yes.
Yes.
I can hear you fine.
Okay, great. So on October 5th, it was Latina Equal Pay Day. And I work with one of the teammates who I supervise. Her name is Norma Jimenez. And she was talking to me about how Latina Equal Pay Day related to abortion care. And I wanted to share some of these facts that I learned with you because it is clear that addressing pay disparity is also an abortion and reproductive rights issue. You might be like, what's the connection point here? Well, our reproductive freedom and also our economic freedom have always been connected. When we make the decision to carry a pregnancy and to parent, people consider the added expenses and also the responsibilities. I was just in California, for example, for my family's reunion, and two of my cousins who are of the same age as me were teen moms. And this is the thing that I remember them talking about the most was the added expense of choosing to have a child. And for them and for people like me, on average, Latinas lose $1.1 million over the course of their time in the workforce compared to white men. These lost wages means that women and their families have less money to support themselves or to even save money. They may even need to forego basic necessities such as food, rent, or utilities in order to be able to afford healthcare needs, which includes reproductive healthcare. So when you think about the decision to overturn Roe, it has also disrupted the economic futures of millions of Latinas. Latinas are the largest group of women of color affected by current and future state abortion bans and restrictions, some of which Jada just talked to us about that were on this slide. Nearly 6.75 million Latinas live in states that have banned or are likely to ban abortion. So when you think about Latinas as a community, we are less likely to be insured, more likely to live in areas with poor access to family planning services, and instead have some of these crisis pregnancy centers that I'm so glad one of the Moms Rising members mentioned at the top of the call as well. And also are more likely to be undocumented. And so the combination of all of those things makes it even harder to access abortion care. We know that nearly 3 million of Latina women live in families that fall below 200% of the federal poverty line. People with low income face lots of obstacles. And I'm talking about Latinas right now, but just think about any mother and or neighbor or friend that you have that also faces economic obstacles, right? Finding childcare, taking time off work, securing funds to travel hundreds or even thousands of miles for care. Jada mentioned that she is in Houston. I'm in Colorado, and I was talking to my teammate at Planned Parenthood of the Rocky Mountains, and we have seen a huge increase of patients out of state seeking care here in Colorado, and they are all from, or the majority of are from Texas. Also, under current law, many immigrants have to navigate a really complicated patchwork of healthcare coverage, sometimes that they have access to, sometimes that forces them to pay for out-of-pocket healthcare services, including for abortion. And I think like in the longer period of time, with our nation's history of white supremacy, discriminatory treatment, forced sterilization, and medical abuse, has led immigrants, Black, and Latinx people also reporting lower levels of trust in doctors and the healthcare system, which might be different than their white counterparts. So I think when you think about the added layers to these hard truths, we see that in its intersection to economic justice, and specifically how it disproportionately impacts women of color, but women writ large as well.
Yep, that's so true. And I always say that marginalized communities are not a monolith, right?
Mm-hmm.
So there are many economical, social issues that come into play here, and all people deserve access to abortion care when they need it and on the timeline they choose.
That's right.
And also in a community that they trust. You know, people should not have to travel thousands of miles
Yeah.
to receive care. And so when we're demanding for our leaders to support us, and when we're asking for our leaders to invest in reproductive health care, we're also in that same breath asking them to invest in education, housing, healthcare, mental health services, and address all of the needs that people living in low-income communities need. Joy, you can go to the next slide, I believe. And so I just want to run through some of these statistics that break my heart, really. 8% of US women of reproductive age, nearly 40 million women, live in states that are considered hostile to abortion rights. 6 out of 10 moms of this demographic who are already mothers need or will have an abortion, or have had an abortion, sorry. 19 million women right now living in what we call contraception deserts and don't even know it. Around 1.2 million of these women live in a county without a single health care center offering the full range of methods. Next slide, please. And this is a story from our reproductive health storybook. Last year and 2 years ago, we collected hundreds of stories from people, women, mothers, who told their reproductive abortion stories to us. And we put it in a storybook. It's online. I'll put all of that information after the webinar. But this young person from California says, "I'm grateful every day that this was a choice available to me. I now am over 20 years sober with a good job. I finished school and got married. My life turned out the way it did because I was able to make the choice for me." Next slide, please. And so moving on to a point that I made earlier in the conversation when I talked about why this is all relevant to an organization like Moms Rising. Why is maternal justice reproductive justice is a question. And so I want to pass it along to you, Angela, so that you can help us kind of dissect this out and explain to us why this conversation is so important to a group of mothers and parents and people who care about family planning and family economic justice.
Yes. I think the first answer is one of the things that you stated at the top of the slide right before this that showed that moms already have abortions. A lot of the times there's a lot of stereotypes about who gets abortions.
Right.
But we know that moms get abortions as well. And I think I also wanted to share about why maternal justice is also reproductive justice from the point of view of Black maternal health. I have these fabulous coworkers at Planned Parenthood named Bianca and Kersha, and they are launching something called the Black Health Equity Initiative, which seeks to answer this exact question. Why is maternal justice also reproductive justice? And we know that we have to improve health equity for Black patients at or via Planned Parenthood, particularly for Black women, girls, and gender expansive people who, number one, experience disproportionately poorer health outcomes in the areas of maternal health, cervical and other cancers, and other sexual health and wellness. And two, are compoundingly hurt by the loss of abortion access and other punitive policies in the South and the Midwest. So at Planned Parenthood, the Black Health Equity Initiative really seeks to center Black women and Black maternal health as something that is interconnected to reproductive justice. For us, it's an investment and also a long-term commitment to ensuring that all people have access to the care and the resources that they need to make informed decisions about their bodies, which means that they can then make informed decision about their lives and also the futures, just like that story that you highlighted shares. So I think to answer the question of why is maternal justice reproductive justice, and why we need to make sure that those two things stay linked, is really to simply look at the health outcomes for Black women across socioeconomic statuses and across geographies. You know, there have been lately in the news stories of like some high profile Black women, like forgetting the name of the tennis player, the really badass one that also has a fashion line. I'm forgetting her name, but she's one of the twins. But she told her birth story and how frightening that was for her. And yes, exactly, Serena Williams. And that was, I don't know why I couldn't think of her name, but, and I love tennis too, but her story is a really good example because she's somebody who has resources and lives in a community that you would think like, oh, well, she's not in those states that we talked about. She has resources, that means that she has access. But no, when you look at Black maternal health outcomes, it is despicable is the word that comes to mind. First, I was like, speechless. Despicable is what comes next.
Yeah.
And so when you look at those maternal health outcomes, you have to connect them to reproductive justice.
Absolutely. I wrote a blog, I think last year, that said that abortion care is critical to to the lives of Black women, to the lives of all women, really. But when we look at the statistics of maternal mortality and the statistics that says that Black women are 3 times more likely to die from pregnancy-related causes than white women.
Exactly.
We see a direct link between the act of abortion and the bans and how it will impact the mortality rates of Black women, because abortion is not going to go away if it's illegalized. Abortions will still happen, and so what we will see is an influx of death, of negative impacts of abortions done across the country. All of the racial disparities, all of the social disparities that go hand in hand with reproductive health care will increase. And so it's despicable, like you said. Can we go to the next slide, please, Joy? And Angela, I feel like you kind of answered this question already. Why is abortion care critical for moms specifically? You kind of answered it in the last portion when you bridged the gap between reproductive justice and maternal justice. But do you want to explain a little bit on a deeper level why abortion care specifically is it critical for mothers and kind of like just bridge that gap right there?
Yeah, and I love that you stated so clearly here that 6 in 10 people who have abortion are moms. That is what I was trying to get at in terms of earlier when I mentioned that there's stereotypes about who gets abortions and who doesn't get abortions. And it's really clear to be able to confront that with the reality of the 6 in 10 number. And I think the other is that like abortion is healthcare. And I think about this all the time because I'm a multiracial Latina, and I know that Latinas have higher rates of unintended pregnancy than non-Hispanic white women because of all of these barriers to abortion, reproductive health care, but also sex education, especially now that Roe has been overturned. Reproductive health care can be really expensive for moms. Many people rely on employer-based healthcare coverage for their birth control. And so for people who are working to make ends meet and also might be uninsured, they might be forced between a birth control method of their choice and also basic needs, which is reprehensible. When I lived in Mexico, I could go across the street to a pharmacy and get a pill pack for 10 pesos, and like the train's 3 pesos, which is a really small example. And 10 pesos for like today's rate would be like about 50 cents, and 3 pesos for to take the train to go to work would be about like 30 cents. So just to show you how like those basic needs are actually like a little bit more, they're better calibrated in other countries, whereas in ours it's not, especially for mom. Because if a mom is not able to pay for reproductive health care, they might be forced to use birth control really inconsistently or incorrectly and potentially put themselves at risk for a pregnancy that they didn't choose or decide. See, all of these things are connected. And, you know, to contrast that example that I gave about when I lived in Mexico, an IUD can cost nearly a full time salary at the federal minimum wage of $7.25 an hour. So now, like, you might be thinking, like, well, abortion care in the context of like the federal minimum wage and the cost of healthcare, this ties what we've been talking about all together for moms. Our reproductive freedom and economic freedom of moms have always been connected because moms make the decision not only to carry a pregnancy and to parent, but also these added expenses and responsibilities along the way. And also like has compounding impacts on the futures of their future child and also of themselves. And women who are denied, women and birthing people who are denied a wanted abortion have to carry an unwanted pregnancy, have also 4 times greater odds of living below the federal poverty level. That was a statistic that my colleague Norma shared with me. And think about it just even years after, right? Years after being denied an abortion that somebody wanted, it was found that women were more likely to not have enough money to cover basic living expenses like food, housing, and transportation. And also, being denied an abortion also has an impact on women's credit scores, their debt, and an increased number of bankruptcies and evictions. I think I remember like when you and I were working together right after Roe was overturned, one of the comments that surprised me the most was Janet Yellen. I don't know if you remember her, but like she's the Secretary of the Treasury, and she said like her statement after Roe fell was all about like how this was going to have drastic economic consequences for women and caregivers. And so, you know, people weren't expecting her to speak out as the Secretary of the Treasurer, but I think it's really clear that besides abortion being healthcare for moms and that moms have abortion, like all of this is like information that moms or caregivers or potential moms want and need. When my first job was that I was a second and third grade teacher, and I had a whole cohort of moms that were taking like an adult sex ed class. Why? Because they wanted to know how to be able to make decisions about their bodies and about whether or not they would expand their families based on their unique circumstances. And I taught at a Title I school, and a Title I school is a school that is designated by the federal government as of having a high concentration of students who receive free and reduced lunch. All of these things are connected.
Absolutely. All of the things are connected. And that's why when we are advocating for bills like the Women's Health Protection Act, we're asking for comprehensive child care. We're asking for permanent paid leave and Medicaid and expanding Medicaid coverage, because all of these are investments that are critical to what reproductive justice looks like. And I know it's becoming redundant in this conversation, but it's true. This is not just about abortion care. Because if you get rid of abortion care, we are just perpetuating and this idea that people don't need care. Joy, you can go to the next slide, please. And so I want to talk a little bit about the intersection, some of the nuances and layers. I know we've kind of already been dissecting and getting at all of the different nuances that are that people face when seeking abortion care and reproductive health care. We spoke about education, housing, child care, paid leave. But I kind of want to get into the nitty gritty of what that looks like for specific groups of folks. So Joy, if you can go to the next slide, please. I want to get into what this looks like for particular groups, because we know that racial and economic disparities in healthcare already exists. What we will see and what we actually are already seeing is that the ones who are most impacted are women and mothers. Of course, we spoke about that. Black women, brown and Latino women, Indigenous, gender nonconforming people, and people in the LGBTQIA+ community, immigrants, young people, people with disabilities, and so on and so forth, groups that are oftentimes marginalized and left out of the conversation around what reproductive health care looks like and means. So Angela, what I want to ask you is if you can talk about some of these layers and nuances that we're faced with when we talk about what we need in terms of equitable access to abortion and reproductive health care.
Absolutely. I think one of the things that I appreciate working at Planned Parenthood is that we have clinics, so we are also healthcare providers, and we work on the political and advocacy side, so I can see some of these disparities in a couple of different ways. For the first, I think it's really important that we go back to the things like healthcare delivery and centering like Black patients and their experiences with maternal health. When I asked my teammates who are working on the Black Health Equity Initiative, I'll be supporting them too with like their partnerships part of their piece, but that's something that they talked about was healthcare delivery. So they're talking about like how to make sure that we're improving the experiences of Black patients who receive care by using, and I'm sorry, my dog jumped on my lap and now he's like growling. So I'm sorry if he makes weird noises. Hey, shh. Okay. Let me just put him over here. Hopefully he comes. Oh, give me one.
That's fine. Dogs.
Unplanned. But okay. We also talked about like using evidence-based methodology to support interventions for really specific outcomes like STIs and Black maternal health. and making sure that we're making strong, sustainable relationships with community partners that are already connected to Black communities. And this is something that any clinic or any healthcare provider can do. And really making sure that we're mobilizing in our organizing work the importance of Black health equity issues across the reproductive ecosystem, because that helps us improve policies. Then I was thinking about the intersection of abortion bans on things like access to birth control, which is something that we've already talked about as critical for us to be able to decide if and when we become parents. But the other one that people don't know as much about is the intersection of these bans on LGBTQ community members. One of my teammates on the government relations team let me know that in their research of like all of these bans, they have seen that in states where abortion is now banned or severely restricted, birth control services that help avert unintended pregnancies have become harder to access for people who are already underserved and rely on safety net abortion providers, because those have had to shut down or relocate. And LGBTQ plus people in ban and access states who are at higher risk for contracting an STI or HIV are actually similarly affected by similar barriers to the sexual and reproductive health clinics that offer abortion care. Trans and other gender nonconforming people are facing anti-trans laws, which also attack personal bodily autonomy. And the same clinics that they get their care at are also at risk of closure, specifically of closure of safety net facilities that have completely severed their access to care that improves the health and quality of life of LGBTQ plus and trans patients specifically. So I thought that those two in particular were really important to highlight, because sometimes people are like, oh, bodily autonomy, the right to decide whether or not to have abortions. And it's much broader than that, right? It's not a surprise that the same people who are putting bans on abortion are also the same ones that are putting bans on gender affirming care, and in those same states. So you're creating this like chokehold on women, femmes, LGBTQ people, and also harming that broader spectrum of care for Black patients, like in the examples that I gave about healthcare delivery.
Yes, yes. Thank you for sharing that. I actually did not know that. But like you said, it definitely does make sense when you think about the folks that are stripping away rights from people, trans people, people seeking gender affirming care, and abortion rights. It's all interconnected. And there's no surprise there, but at the same time, it does put those communities and all of us in a chokehold. And at times it does feel like we're fighting many fights, having many swords at once. I actually want to do something interactive with the audience, and I want to ask folks to put in the Q&A box if you have had experienced disparities when seeking abortion care or reproductive health care, and if, similar to what Angela was explaining, if you could add any layer, or if you can add a nuance to this experience, what would that be? And what did it look like for you? Because I'm just interested, and also I would love to broaden the perspectives of all of us, as all of our experiences when seeking care looks different. So if you have an experience, if you feel safe enough to share, or if you just have, a perspective that we could add to this list, please put it in the Q&A. And I'll give about 30 seconds for that. Thank you, Martha, for sharing. Yes. Martha says that she's so afraid. I'm assuming, I don't know your pronouns, I'm sorry, that they are so afraid for so many who do not have medical support, especially with this becoming a male option. Healthcare for all is really needed. Agreed. Oh, Laura, the added stress of protesters can be terrible. That is definitely a layer. Safety is a layer. In West Virginia, we do not have access to healthcare facilities close to home in our rural areas. We have a large population that have no access. Again, transportation, having care in a safe community. Yes, all of these are layers for sure. People with disabilities, Nikki, that's a good one. People with disabilities whose life-saving medications are now considered abortifacient. Trusted care, that is a great point. Oh, these are great. Thank you so much, everyone, for adding these layers. Thank you so much. Substance use disparities, yes, and mistreatment, judgment, yes, those are definitely layers. Thank you so much. Okay, I think we can go to the next slide, Joy. Kerry Washington recently shared her story, her abortion story. She says, we're at a moment where it's really important to be telling the truth about our reproductive choices because some of those choices are being stripped away from us. Next slide, please. And so, sorry, I lost track because those are really good layers. So I'm thinking about it. We are changing the narrative at Moms Rising, at Planned Parenthood, and all of the reproductive partner organizations that we're working with that are doing this work every day to disrupt the stigma. Regardless of what anyone says, abortion is healthcare, and now is the time to ensure that every person with the ability to give birth has access to the legal right of abortion care. And this impacts all of us, even those of us who may not even be in need of an abortion. Reproductive health care services. This is not a parents and moms issue. This is a national economic injustice issue. And so, Angela, I want to ask you, how is Planned Parenthood taking action to change the narrative and disrupt stigmas against abortion care and motherhood?
I think your example of the storybook is such a good example of how you can change the narrative. Because those stories, whether they're in a storybook or whether you share them on chats like this, or go to your local representative with your Moms Rising teammates during a lobby day, or if you just go on social media and share your story and tag a representative who's like either helping or hurting, is a really great way to change the narrative. And I just want to recognize that I see that Moms Rising is doing that work and that I really appreciate working with Moms Rising. I think some of the policies that you can advocate for, like on a federal level, something that that can help us get those rights back, like the people who were sharing at the beginning of the call, in light of Roe being overturned. You already mentioned the Women's Health Protection Act, or WIPA. Another one that a few others that I would mention are about legislation that restores and also expands access to abortion, but also make sure that there's equitable access to healthcare. So one would be like the EACH Act, and the other is the Black Maternal Health Momnibus, which I know that you all did a ton of work on. So those are two policies. And I think it's really important to like, one of the ways to change the narrative is also by celebrating the champions. There are a lot of people who are attacking us, but there's also a lot of people who are our champions. Um, for example, in June of this year, Representative Watson Coleman introduced a resolution that acknowledges the importance of the intersectionality for abortion access, specifically around the women of lower socioeconomic standing and women of racial and ethnic statuses that are at highest risk when abortion is restricted. That is a great example of changing the narrative, because she knows that in the House, like, passing something is going to be challenging. So she passes something that's literally aimed at changing the narrative by passing a resolution. And so that's when we can send thank you cards, when we can call in and say thank you to people like Representative Watson Coleman who have done that. Similarly, at Planned Parenthood, we're also, because of the same reasons that we've already talked about, in terms of the connection between healthcare and abortion as healthcare, is it's really important to work with states to expand Medicaid. This is one that people often don't talk about, but actually, like, knowing now that the fight is in the states, being able to make sure that states have done everything that they can to expand Medicaid, especially because Medicaid has those maternal health provisions that are new too now, or that are included, and other publicly funded social supports really is another way to change the narrative about abortion access, because it advocates for policies that provide that wraparound full support for women and families and caregivers. And at Planned Parenthood, we've also been working with agencies like CMS that administer and oversee these programs to make sure that they improve enrollment, and especially the enrollment after it has been dropping off. Like, most recently, like, we saw this window of period where a lot of people got kicked off of Medicaid, and people need to re-enroll. So it's really important that the federal government and that we as people who are advocates are working with the federal government to make sure that people are able to enroll for things like Medicaid coverage, for the expansion and family planning aspects of that, for Title X, for SNAP, TANF, WIC programs also that supply cash and nutritional assistance, public housing and voucher programs for people who face housing insecurity. An example of like how we at Planned Parenthood are supporting the enrollment is there is a program that we have called Raiz. And Raiz is a Latinx organizing program that our affiliates run. And it was actually created as a direct response to the disproportionate amount of Latinos living without healthcare coverage. And during the Affordable Care Act enrollment. So the organizers back then and now, even to this day, we're on the ground, door knocking, working in communities to make sure that people enroll in the ACA. And in just a few months, they were able to enroll over 700,000 people in 2 states. And those are still things that we could do to this day, right? Like, are people in our community enrolled for the programs that they are already eligible for that wrap around and support healthcare coverage broadly?
Absolutely, yes. You're right. The conversation around Medicaid and abortion care is often put to the side or seen as two separate issues, when in fact they are one. But I especially love what you said about a part of changing the narrative and disrupting the stigma is uplifting our champions who fight for us every day, right? But it doesn't just have to be people on the hill that we uplift. We have to make sure that we're also lifting up people on the ground, the people that are seemingly smaller folks, but really have the loudest voices when advocating for abortion care and against aunties. And And so, yeah, I especially love that point. At Moms Rising, we collaborated and partnered with, and you were there, Angela, too, Black women-led organizations on the ground in Jackson, Mississippi. And we really made sure that if we were going to be in their neck of the woods on the ground with them, that they were at the forefront and center of all of the abortion advocacy work that we did out there. And that was, to me, that was a statement in itself, the fact that, we could have put the big names at the front, like Planned Parenthood. We could, as Moms Rising, been at the forefront of that movement. But it's very important to us that if we're going to be advocating for the folks that are in need, that they are the face of the movement. And that is how we are disrupting the stigma and changing the narrative as well. So I love that point. Joy, you can go to the next slide. That's pretty much sums up this conversation, but we don't have time, but I do want to interact with you all. And if you have questions and things like that, I'm here. I don't have anything else to do. So I think if you want to spend like maybe 5 more minutes to wrap up, that's fine with me. But I just want to say thank you to Angela, thank you to the Moms Rising team and everyone that joined tonight. Reproductive justice cannot wait. I would love for you all to join our movement. If you go to the next slide, Joy, there's information there, I think. If you want to become a member, visit MomsRising.org, follow us, Moms Rising on Instagram, Twitter, and Facebook. We're everywhere. And we even have a Spanish-speaking community, Mamas con Poder, mamasconpoder.org, where you can join. You will receive our content in Spanish and be able to interact with the Spanish-speaking communities. And yeah, just get into, the groove of Moms Rising. We would love to have you. Thank you so much. Joy, I don't know how you usually do the question and A portion. Should I just go for it, or how does it go?
If folks have questions, this has been lovely. If folks have questions, please put them in the Q&A. Or you can come off mute and ask your question directly. And we'll have space for a question or two.
Deborah says, this is a voting issue 100%.
Can I just make a comment? Every single thing you're talking about, it boils down to red states versus blue states, the rights in red states and the rights in blue states. So I personally think that a tremendous amount of focus should be on getting the vote out to vote blue, because I don't care how much you do. If you're in a red state and you have the politicians that are in those red states, like a state like Texas, nothing's going to change. There's nothing you can do. So we really need to get the message out about getting Democrats and getting the blue vote out in order to get different politicians in there and to get the law changed. That's the crux of every one of these issues you're talking about. I live in Maryland. I don't deal with all this because I live in Maryland. Of course, I deal with the abortion being against the law, but all this other stuff you're talking about, I do not deal with. But I mean, it's so much more than that that's going on in our country right now, against LBGT and banning books and, all this misogynistic stuff. I mean, it's out of control. And we got to get rid of these red states and these red politicians.
Thank you so much, Deb, for sharing that. Thank you for your comment. It is important to vote. Voting is a core component of our work on Moms Rising. And yes, get out there and exercise your right to vote. Thank you for that again, Deb. Kathy, I see your hand up. I would love to.
Yeah, one of the things that came to my mind when you were talking about the nuances and layers to this issue is that many women experience domestic violence when they're pregnant or right after having their baby. And I think sometimes we don't remember that there's also that issue of, if a woman gets pregnant and has a child, like her chances of being able to leave an abusive relationship is really impaired because she doesn't have a job and now she's got an infant to take care of. And having the access to get an abortion could mean the difference between life or death in some violent situations. So, I think that's another layer that we're maybe not aware of.
Yes, that is definitely another layer. First, I want to say something to Deborah's point about red and blue. There's a statistic that came out recently that said 69% of Americans support abortion. So yes, we know we need to vote in the right direction, but also majority of us already believe that abortion should be legal across the board. So how do we convey that, but I do agree with you. And to Kathy, yes, I do think that that is something that is overlooked. People who experience domestic violence is a marginalized group, as a group that needs to be included in these conversations more. Angela, I'm not I don't know off the top of my head, but do you know any DV groups off the top of your head that are working specifically to combat to support DV survivors and those that are in need of reproductive health care?
Yeah, the people who worked on helping to reauthorize the Violence Against Women Act, or VAWA, are also fighting in the same coalitions as we are to restore access. So I would say, like, if you Google Violence Against Women Act, you will immediately see all the groups that worked on that. And that is such a important nuance. It's another one of those, tonight we talked about layers. That's another layer of a population. And I wanted to make a comment too about the red and the blue states. One thing that we have to watch out for is the Supreme Court and the cases that are coming up to the Supreme Court. I wasn't going to talk about this one, but we're not litigants in this one, so I can talk about this one. And this one is the Miffy case. Have you heard about the Miffy case, the mifepristone case? So, sort of, okay, the little quick snapshot is that, and sorry that my dog is still growling. He's seeing his shadow and growling at his own shadow. But mifepristone and misoprostol are the two medications that are used in medication abortion. And a group of anti-abortion people have sued the FDA and filed the case in the state of Texas, and have basically tried to get the FDA to stop authorizing the use of mifepristone, which is in the United States the more common of the medications that's used, because it's used with misoprostol as well. They're basically trying to get rid of that pill on the market. And that case is working its way through the court system and will make its way through the Supreme Court. And if the Supreme Court finds or rules in favor of that anti-abortion group, it does not matter if you live in a red state or a blue state. That medication will cease to become available and or will be severely curtailed depending on what the ruling looks like. And so that is another case that we're working on, and that Moms Rising is also in a coalition with Planned Parenthood about. So keep also an eye out on that case, the mifepristone case in front of SCOTUS. It's definitely important to vote, like she said, and it's important to watch out for that case, the mifepristone case, as it works its way through the Supreme Court as well.
Thank you so much, Angela, for that. That is 100% and very valid point, that we're being attacked from all angles. And so in the same vein as Deborah mentioned, vote in the correct direction, yes. But also keep an eye out for powers that go way beyond voting, and our voter privileges as well. And I think we have room for one more question from Martha.
Yeah, as someone who just had that, I have a lot of complicated feelings about it. So that combination is, I'm now learning 80 to 85% effective. I'm that 15% that it was not effective for. So and after the whole ordeal, which ended up in the ER, my doctor was like, I've noticed that women with C-sections, this isn't very effective with it. And oh yeah, with your uterus, we probably shouldn't have gone with this choice. So I also know research around when is this effective and when is it not is also seriously lacking. And I have a lot of feedback from my own experience, and I'm privileged to be in DC with excellent healthcare and all the rights. And so I'm wondering, who do I talk to more? How do I get more involved in the policy of this? Because I can tell there's a policy vacuum. This drug needs to exist and it needs to be there, but also they need to know when it's not going to work. And more bodies of research need to be focused on that, because I really could, I really should not have been given this option and just gone straight to a different option. So that's why I'm now super passionate and wanting to put more time and resources into this in positive ways, not that are deconstructive, but
Yeah. Well, first, thank you for sharing that experience and that story. You definitely didn't have to, and you chose to. And so not everybody learned from you and what you shared. So that's first. And second, I think you also gave another really great experience about why abortion care is healthcare. Why didn't we already know that? Why didn't your doctor already put that into practice? No disrespect. But like you said, I'm just like sitting here being like, it's like another example of we silo abortion care away from healthcare, but abortion is healthcare. And if we treat them as one and the same, I feel like that creates, alongside like active advocacy as well on the specific like type of research that you mentioned, is like another good example of like why those two things need to be interconnected. And I'm sorry that you experienced that.
Sorry too, Martha, and thank you for sharing your story. I want to add on to what you're saying, Angela. Your story is the advocacy, Martha. Your story, you telling your story is the advocacy. I don't think, I'm not, like you said, I don't think there's that much research out there about what you're experiencing and going through. So by you telling your story and getting your story out there, you will inspire other people, that 15% that you spoke about going through that same experience. And then as advocates on our end, as policy advocates, we can begin to advocate for investments towards the research and towards the policies needed to make sure that things like that do not happen to anyone. So I just want to say that, and this is a message to everyone, that your story is the advocate. Being an advocate doesn't always look like being on the Hill and meeting with legislators. Simply telling your story and your experience and your perspective is the advocacy. So thank you for sharing that. And I'll pass it along to Joy.
Absolutely. Thank you so much. Thank you. A big, big thank you to Angela for joining us and Jada for leading the conversation. It has been insightful, informative, a little bit sad, but extremely hopeful, because there was work to be done, and we're part of the people making that happen. Thank you all so much for sharing your stories. Like Jada said, sharing your story is a big part of the advocacy work we do, right? Like when we have our voices heard, when we make other people hear our voices, we start to shift power back to our communities and we get things done. So if you are interested in continuing to share your story, please email us, keepmarching@MomsRising.org. We would love to like provide you and support you through that process and develop your activism. As always, this conversation has been recorded and I will be sharing it in the next couple of days. Thank you so much for joining us tonight, and be on the lookout for our next Keep Marching meeting. It's looking like we might need to have a conversation about the Supreme Court and what is going on over there and how it impacts our lives, okay? So be on
Okay.
the lookout and have a wonderful night, everybody. Thank you so much for being here. I will see you next time.
Thanks.
Good night, everybody.
Good night.
Thank you for the input.